Hello and welcome to Open Forum. I'm your host, Nicole Fox. People are emotional beings, and anger is one of the most complex emotions we have. Anger is normal, but it can cause problems for people who have difficulty regulating it. Today on Open Forum, we're taking an in-depth look at the topic of anger management, a practice that we all need from time to time. Today we'll hear how to cope with one of the most intense of human emotions.
I've been watching.
My favorite show, Desperate Housewives. You know it's on.
I don't watch that.
I watch one show once a week.
You know, I just can't deal with this. Your voice is like a drill in my brain. What is this, huh? Oh, did you go out shopping again? You always yapping on about your sister. Just clean the house. Just clean this pigsty up, all right? Just please clean this up once in a while.
This is ridiculous.
Have you been on the computer? Were you on the computer again? I told you to keep.
In our complicated modern lives, many people struggle to cope with everyday problems. Some experience feelings of anger on a regular basis, perhaps more often than they'd like to admit. Dealing with those feelings of anger is sometimes difficult. For some, anger management therapy is an important tool for them. Dr. Deborah Pliner is a licensed therapist who sees many patients for anger management.
My degree is in clinical and forensic psychology. My background actually was working with mentally ill offenders. So that's how I actually got into anger management, because a lot of that was helping them to deal with anger and, you know, how can they express it without getting into trouble, getting into legal trouble and, you know, winding up in jail.
If I wanted it, I would have bought it for myself. Did you ever think of that? My God, and what is all this stuff on the table, huh? Just get this off the table already.
Anger management is a way of dealing with the emotions and the physical parts of anger. It's helping somebody to be able to express anger in a way that's productive.
Dr. Howard Casanova is the director of the Institute for the Study and Treatment of Anger and Aggression at Hofstra University in New York.
Anger is a negative psychobiological response. And by that I mean very few people get up in the morning and say, boy, I hope I'm angry all day today. So it's negative. It's something that we typically don't want to experience. Psychobiological means it has a psychological component of thinking about the other person, fantasizing revenge, saying to ourselves that we're angry, etc. The biological component, of course, is the increased heart rate, the sweating, the energizing of the body.
If anger is a negative emotion, does that mean it serves no purpose for us?
Anger can come out in many different forms. It actually serves a function for us. You know, it lets us know that maybe we need to take action against something or protect ourselves. It can even motivate us to achieve.
Anger clearly has a functional component. I couldn't imagine living in this world without some anger. And by that I mean we all go to the movies. We enjoy seeing anger on the movie screen. Anger adds a zest or a spirit for life. When you want somebody to really listen to you and you raise your voice, that anger, and I'll call it anger for a moment, is a signal. And it says, pay attention to me. What I'm saying now is not talking about the weather, but I'm talking about something meaningful to me. Please listen. So anger clearly has that positive aspect.
The experts agree that anger is normal and can even serve a purpose. But what happens when it's out of control or not expressed in a healthy way?
He gets really angry over really small things, and if nothing goes his way, then we're all suffering from his anger. They just can't control themselves and get upset over small things and, yeah, get really mad.
Is there a specific way to determine when anger is being expressed in an unhealthy way?
We think in terms of frequency, intensity, and duration of the anger experience. As a normal human being, you and I are supposed to be able to regulate our anger. Anger becomes dysfunctional when it becomes too strong, when it gets to the point where you're thinking about the fantasy of revenge rather than returning to your work.
Dr. Casanova describes the negative consequences that come from an inability to regulate feelings of anger. Personal relationships, professional development, and even physical health can all be damaged by anger problems.
Anger leads to a whole series of very negative outcomes, interpersonal problems. As I've said, very few people decide they're going to have a party this weekend and invite their 5 angriest friends. They only want to invite people who have regulated emotions. So it causes interpersonal problems. People very often who are highly angry may not move forward in their job or their occupations. Anger is associated with drug addiction, alcoholism, property damage. Anger is associated with medical problems. People who are continually angry are 3 or 3.5 times more likely to suffer with a stroke, heart disease. Some people think cancer is increased for the chronically angry person.
You know, you keep this house dirty. You don't even, I just can't even handle the way you do stuff. You know, I just want...
What's it like to be around someone with an anger management problem?
I stay away. I don't say anything to him.
They bring down the atmosphere for everyone. They make it so it's not as good of a time.
No one wants to be around someone who's angry all the time. That's why angry people tend to have more problems in their work life and in their relationships. Dr. Casanova explains that even if we wanted to never be angry again, that wouldn't be possible. He explains why.
It is impossible to get rid of anger because it is partially caused by our biology. We're pre-programmed, where we say we're hardwired to react strongly when we perceive that we're threatened.
It is normal to get angry, certainly when we're threatened, whether it's physically, mentally, emotionally, and that is when that fight or flight mechanism kicks in. That doesn't mean we always have to necessarily respond to that, that feeling that gets triggered. That's why anger management is so important in raising awareness so that you can actually stop and make a decision. Do I need to fight this? Do I need to run? How do I need to handle this?
Anger is a biological response. There are specific chemicals in the brain that are activated when our emotions are triggered.
When we perceive something aversive, when we're threatened, or maybe neglected or rejected, or there's some kind of an anger trigger, we go into a state of heightened arousal. The chemicals are secreted. We have these catecholamines or hormones, there's epinephrine and there's norepinephrine and dopamine and cortisol, and their whole purpose is to energize the body and get us ready to deal with a threat of some sort.
If this process in the brain is normal, how can we possibly control it? When we come back, we'll see how and why anger management therapy can help those who need it.
Anger that's too frequent and too intense, those people need anger management.
What type of person needs anger management therapy?
They get mad really easy for small things. Those people don't know how to solve the problems.
But typically the people that need anger management are people that have a low frustration tolerance. And because of that, then they have trouble actually tolerating other emotions that wind up affecting them. So it could be somebody, of course, like who's, hot-headed, easy to kind of snap. Warning signs of anger, first of all, are people who have a lot of outbursts. They might get into arguments easily. There are people that could have actually physical problems like headaches and stomach aches. They can often have relationship problems, problems at work, and in really extreme cases, there are people that could have legal problems like getting arrested for assault or property damage.
He's punched holes in the wall and ripped off his closet doors before.
Dr. Casanova explains that when a person holds on to an angry feeling long after a situation is ended, that's when it becomes unhealthy.
Anger is associated with fantasies of revenge. So, many of us will have this fleeting thought, I would say, that, she plays her radio too loud at work. Well, maybe I'll play my radio too loud at work. If it's a fleeting thought, it's okay. If you go home and you purposefully, vengefully figure out how you're going to get even, and you hold on to that for a long time, that's dysfunctional.
Another important part of anger management has to do with identifying triggers. You know, people have lots of different hot spots, things that set them off. And it's important to recognize what are those triggers so that when you're in that situation, you can actually be prepared. And then it starts to happen and you start to get into that situation and you can say, okay, you know what, this is a situation that usually is difficult for me. Maybe I need to take my time. Maybe I need to think a little clearly before I react.
When a person has decided that they may have a problem with anger, or when someone around them has told them that they're angry too much of the time, that's when it may be time to get some help.
The first step for anger management generally starts with helping the person to recognize when they're getting agitated, when they're getting worked up, before they actually have an outburst. And this can be sometimes the hardest part for people. It's really difficult.
What do you think of that? What do you think? Oh,
You know what?
give me this.
I don't understand you. You know what? You need to get therapy.
Oh, I need therapy,
Yes,
huh?
you
Oh, yeah,
do.
I need therapy.
You need
Sure, I do.
therapy. You know
Oh,
what?
you always think
You
I'm
get
crazy? Is that what you're saying? Saying I'm crazy?
Yes.
I'm not
Yes.
crazy.
One of the things that we can do is help the person to recognize the physical signs of anger. Maybe it starts like in their stomach and they start to feel like a burning, or maybe their heart starts to beat faster or they start sweating. Those are all physical signs of anger that can then sort of serve as an alarm bell to somebody to say, hey, wait, I need to hang on a second, you know, take a step back.
The Institute for the Study and Treatment of Anger and Aggression is located at Hofstra University in New York.
Well, this is a training and treatment facility and research facility. We have a group of anger management therapists. Right now I have 10 who I work with, all trained at the master's level in psychology and anger management. We see patients from the community. About 50% of the patients that we see are independent referrals. They know about our services, they apply, make a telephone call. We do an intake, and if appropriate, we bring them in for anger management. The other half come from the Department of Probation or the legal system here in Nassau County and surrounding areas. So we do both. Once we decide that somebody's appropriate for treatment, then they are put on an anger management treatment protocol. And that could run 10 sessions, 20 sessions, sometimes longer. First is the preparation stage. The patient comes in and says, I don't know what I'm doing here. My wife sent me here. You know, she makes me angry. If only you'd fix her, I'd be okay. When we begin there, we sometimes will give these paper and pencil measures of anger. And we'll say, look, you know, I understand what you're telling me about your wife, but you scored at the 98th percentile on anger. Sometimes the people will say to us, wow, they did? I didn't realize I was that angry. It's harming your life. And it has all these outcomes. The property damage, the medical problems, the interpersonal problems, etc. So preparation phase means making them ready for treatment.
Dr. Casanova describes what kind of therapy is used to help people overcome their anger problems.
Cognitive behavioral therapy is the modern treatment of choice for many disorders. And it has two parts to it, cognitive therapy and behavioral therapy. Behavior therapy is the traditional form of intervention, which means changing motor behaviors, the pushing, the yelling, the screaming, through changing reinforcements that occur when you behave that way, or changing the conditions that lead to it.
You know, I've got a lot of stress, you know? I've got a lot of people depending on me. You know, my boss is always yelling at me. You know that. I've told you this many times.
Most often, the negative things that happen are not necessarily the root cause of anger, but rather how we think of those things.
Most of the time, it's not the fact that you took my parking place, it's how I perceive it. If I think of you as an evil person who's self-centered, who should know better, and you took my parking place, well, you're a jerk and I'm angry. If I think of you, you're probably an old woman You may have need a wheelchair. You don't see so well. You didn't see the sign that said it was my parking place. And I give you the benefit of the doubt. I'm not going to get angry like that. The emotionally disturbed automatically assumes the worst. The emotionally healthy person objectively looks at the situation. And you took my parking place? Is it really the end of the world? Maybe not.
So it is the ability to put things into perspective that helps us cope with negative events. That ability to cope is vital to maintaining a healthy emotional balance.
Let's assume for a moment that you become angry when people call you fat, or when you think people are gossiping about your weight behind your back. In the change phase, what we do is we teach you first deep muscle relaxation.
Mr. Robert Gruenfelder is a student at the Institute. He and Dr. Casanova demonstrate how this type of therapy is done.
This is a series of tension, relaxation contrasts. Tense now, make your face really tense. Notice the discomfort, tension, and relax. Taking a deep breath again in, where you learn to drop your shoulders, sit comfortably, take those deep breaths, and bring your body totally under control. Then what we do is we deliver that aversive verbal stimulus to you. We say, are you ready? Here it comes. You seem to be fat. You're getting fat. One final deep breath in and out. And now slowly come back to this room, to the table, and open your eyes. The idea is to make them less reactive, to change their responsiveness to the stimulus. And so in this state of deep muscle relaxation, we can say it over and over and over again and ask them to rate how angry they become. What you find is that as you say this over and over again, in the state of relaxation, their reactivity eventually disappears. Not that anyone likes being called fat or pimply or four eyes or whatever it may be, but they become less angry when they hear it.
Renita Pekarsky is studying with Dr. Casanova at the Institute for the Study and Treatment of Anger and Aggression. She sees many patients dealing with anger issues. Ms. Pekarsky is studying how anger is expressed when people are driving.
There has not been much research conducted on angry and aggressive driving behaviors or road rage in general, which isn't very surprising since anger is a very understudied emotion. A lot of the studies focus on depression and anxiety, whereas, they neglect anger. That is surprising because it is such a common emotion and it's seen every day. In most cases, the research focuses on a perceived inflicted grievance, which is basically the driver feels that or thinks that someone is purposefully cutting them off or, driving in a way such as to harm them, or it's all about the driver, and, they focus really on what they think the other person is doing to them, and that elicits much of the anger that they experience.
Ms. Pekarsky is studying how anger turns to road rage.
I think you want to pinpoint a specific issue. So let's say a couple has an argument. You want to be able to help them focus on what ways that they can resolve that argument. So you want to watch a specific television show. Your partner, switches the TV station to another television show. What ways can you resolve the problem? Are you going to just take the control and switch it on them? Probably not. Are you going to maybe use an assertiveness technique to are you going to use assertiveness to communicate your feelings effectively? Maybe that would be the best choice of action. And then you could discuss other options that they might have, storming out of the room, not saying anything at all, and then pick the best course of action.
In this type of therapy, a person becomes able to deal with things that bother them in a more positive way. These triggers lose their power, and the patient gains more control over their emotions. Another step in anger management is learning how to handle things that bother you By taking a positive, reasoned approach to a person who has done something to offend you. Working things out in a more constructive way helps reduce unhealthy behavior.
If I, as a man, just yell at my wife, put her down, it's not going to work. If I hold it in, it's not going to work. But if I communicate, when you did this, I felt annoyed, and I'd like to talk to you about it so we can make it better in the future, that middle ground makes for a better marriage and a better society.
The good news is that anger management works. Even the most horrendous examples of injustice have been forgiven by people who want to reclaim their lives and live without anger. That's next when Open Forum returns.
This man told us that he was in a group of parents of other murder victims, and after 10 years, 15 years, 20 years, they were still in this group being angry.
I say, take a breath, breathe in.
No, just say take it easy and deep breath, that's it.
We do some stuff about forgiveness, which I think is really interesting. And I've used this actually before. And this process kind of takes some time, and it does involve perspective taking and letting go. So often if somebody has done, if you've perceived that somebody has done an injustice to you, and you can't really resolve it with that person, but you still have issues that cause anger inside, how do you cope with those? And maybe forgiveness may be the best way to go in terms of in terms of getting through the situation for yourself.
Dr. Casanova explains how patients are taught to deal with the emotional triggers that make them angry.
We had a man that we know of whose son was murdered, and the murderer went to jail. But what happens next? It's not enough. You have to eventually let go. This man told us that he was in a group of parents of other murder victims, and after 10 years, 15 years, 20 years, they were still in this group being angry. And at some point, you have to let go and move forward. The man whose son was murdered eventually argued before the parole board to let the murderer out of prison early. And when the murderer got out of prison, they maintained a relationship for a while. Now, these are very difficult cases. We want to teach forgiveness and acceptance strategies. For some cases, change and improve relationship strategies. And the final phase is relapse prevention, meaning that we know that no matter how good our anger management programs are, there are all of these potential assaults out there in the environment will continue to be neglected and rejected and verbally abused and misunderstood and gossiped about. And periodically we say to our patients, be prepared that you may still have an anger reaction. It doesn't mean that you've forgotten all of these good skills. You may need 1 or 2 sessions of additional management, but we want to prepare people for relapse.
I think that with treatment, people who experience extreme forms of anger can manage their lives more effectively. I've seen it, and it is kind of like learning how to ride a bike. At first you're kind of wobbly, but then with practice, you become better at it. And I think that that's a good analogy for people who elect to go through anger management.
We've all seen the pop cultural references to anger management, the jokes about deep breathing and thinking happy thoughts. Well, as it turns out, these methods really do help us deal with feelings of anger. But for those with real problems dealing with extreme anger, obviously more intense therapy may be required. If we are unable to manage our anger, it can have a negative effect on all aspects of our life. Anger can often cloud our judgment, shift us away from our inner value system, and take a real toll on us. Uncontrolled anger often affects individuals around us as well as in our society in general. Therefore, we need to practice better anger management skills. We hope this edition of Open Forum has brought you some useful information. I'm Nicole Fox, and we hope to see you again next week.